Hi everyone, my name's Gabby Musk and I'm here to present some of the rationale and the content within a new set of guidelines about anesthesia and analgesia for prepubertal and unsocialised cats for desexing. But before I get into it, I'll just disclose that these guidelines were commissioned by RSPCA Australia, and within the guidelines, not so much today in the presentation because of time constraints, but within the guidelines there is reference to the off-label use of drugs. So these guidelines were launched just recently, about a month ago, and they're available through the RSPCA, and I'll show a QR code in just a moment. But they were developed with the target audience being private practitioners who may not feel as confident as they could be about tackling the anesthesia and analgesia for prepubertal cats for desexing. When we were developing the idea for these guidelines, we ended up also including another cohort of cats which present challenges for private practice vets, and they are unsocialised cats, which are difficult to examine and to handle. So the two cohorts of cats are included. Throughout the guidelines, there's reference to the particular details that might be relevant to one of those two cohorts, but otherwise the content is applicable across both cohorts of cats. So the documentation attached to this webinar includes the actual guidelines, but if you want to find them yourself on the RSPCA website, then you can scan this QR code to find them. I was the primary author of the guidelines and created the first draft, which was then reviewed by the veterinary officers in the RSPCA and also private practice veterinarians that work in practices with a high feline caseload. And then finally, the final round of review was by members of the chapter, the Veterinary Anaesthesia and Analgesia chapter of the Australian and New Zealand College of Veterinary Scientists, which then meant that they could be endorsed by this special interest group, and the only one in Australia for that matter, of veterinary anaesthesia and analgesia. So just as a little bit of background to why these guidelines were considered to be filling a gap, is that desexing of cats is an important strategy in managing cat populations. Desexing will decrease the incidence of unwanted litters, decrease the inclination of cats to roam and to get into strife. However, desexing brings with it some risk associated with anesthesia and analgesia, and depending upon the age at which desexing is performed, there may be concerns, unfounded or not, about whether or not early desexing alters the growth of cats, and maybe when they're really little, it's a more difficult procedure to perform. The RSPCA did publish a report in 2021 about prepubertal desexing of cats, and the recommendations within this report concluded that cats should be desexed as soon as they reach 1 kilo or 8 weeks of age if they're in a shelter, if they've come, they're going to be homed through that kind of avenue. Or if they are already owned, they should be desexed when they're 3 to 4 months of age. There should be an education piece to the public about just how young cats can start breeding, and therefore the value of desexing them before they can start breeding, and that private practice vets should promote prepubertal desexing to ensure that cats are desexed before that opportunity has gone. The recommendations also came up with the suggestion that vets and universities and animal welfare organisations should collaborate to develop resources and to educate both vets and the cat-owning public. And I guess this is where these guidelines that I'm going to discuss a little bit today have come into the mix. But within that report, before we get into it, the welfare benefits of prepubertal desexing were identified as being associated with a faster surgery, with less tissue trauma, shorter anaesthesia time, with fewer wound infections, and therefore a shorter recovery time from the surgery itself, with actually no difference in morbidity or mortality for young cats, prepubertal cats that have undergone desexing and anaesthesia as well, obviously. There were no difference in health issues following surgery between younger cats and adult cats. And obviously, desexing has a welfare benefit of preventing unwanted pregnancies. And therefore, the overall cost with regards to surgery and anaesthesia, even consumables and suture material, is lower for cats when they're desexed much younger. So currently, these figures are already a little bit out of date, but the most recent information about just how old cats are when they are being desexed in Australia shows that only 85% of cats are desexed by 12 months of age, and the median age of desexing is 6 months. This study from 2021 shows 2 epochs of cats at the ages at which they were desexed in Australia, and we're getting better at desexing cats younger, but still the median age is 6 months, and the interquartile range is spreading only from 5 months to 9 months. So the idea with prepubertal desexing is that it's done much earlier than that. However, there are a number of reasons why cats aren't desexed before puberty, and the barriers to this early desexing have been identified as including the perception that it's better for the cat to be more mature before it's desexed, the perceived risks of anaesthesia and analgesia, the complexity of surgery perhaps on a very small animal, the perceived lack of applicability to a veterinary practices area where they might not see that unwanted pregnancies and excessive kitten populations are relevant to the area that they service, and also a lack of compliance from owners. So it's this particular barrier to early desexing that we will cover in these guidelines. So as I mentioned before, the focus, at least initially, was on providing a resource for private practice vets, so not shelter vets who do this regularly and have a high volume of cats for desexing that are often desexed at a prepubertal age, but for general practice vets who may not feel they have the confidence or the knowledge to take that approach earlier on in life. And then we added this cohort in of unsocialised cats as well. This set of guidelines is not an exhaustive recipe book. There are a lot of ways to anaesthetise cats, and there was no way that every single approach could be included. But I therefore want to take this opportunity to say that if you're really familiar with an anaesthetic protocol, that may well be the safest option for you to use. And throughout this set of guidelines, there's less of an emphasis on the drugs that are being used as opposed to the techniques and the supportive therapies that can be provided or should be provided. So safety in anaesthesia relies heavily on being familiar with the drugs that you're used to using and understanding their effects, their side effects, and their duration of action. There's also a lot to be said for really bedding down that fundamental basic good supportive care and supportive techniques and those foundational practices in anaesthesia to be safe, and not to get too hung up on the nitty-gritty of fancy techniques, but really bedding down the basic good solid techniques to deliver best practice. Okay, so prepubertal cats are defined as those between 6 and 16 weeks of age, and a subset of these will be paediatric. Their physiology won't be mature yet. Their central nervous system physiology, their autonomic nervous system physiology, cardiovascular, respiratory, and so on are immature. So they do require a different approach when it comes to anaesthesia and analgesia. So the guidelines are laid out as follows, with more or less a chronological approach to planning an anaesthetic and performing an anaesthetic and managing post-operative pain. So there's a little bit about the approach to anaesthesia, pre-anaesthetic assessment, the equipment that's required, animal preparation with regards to fasting and so on, pre-medication options, approaches to induction of anaesthesia, and then maintenance of anaesthesia, during which time supportive therapies need to be provided, monitoring needs to be performed, and then moving into recovery and analgesia and pain assessment as well. So the guidelines are laid out with those subsections, and I'm just going to touch on some of the sort of more controversial areas within that, or some of the important parts of managing anaesthesia that warrant a little bit of extra attention today, because I just don't have enough time to go through it all in enough detail. But it's important to get this right, because understanding that there's always a risk with anaesthesia is important, and the only way to manage risk is to identify those hazards and to mitigate the risk by understanding what contributes to the incidence of morbidity and mortality, and in this instance in cats. And the most relevant study recently showed that in healthy cats undergoing desexing, the mortality rate was 0.1%. So if we bear that in mind, then we can think a little bit more about how to manage risk. One of these studies showed when that mortality was occurring, and 19% of cats died as a result of anaesthesia during the maintenance phase, and actually 42% of them died within that first 6 hours of anaesthesia. So they're the times where we need to be particularly focused on ensuring that everything is safe. One way to do that is to make sure you're all geared up and prepared as necessary. And there's an appendix to the guidelines, which is this Association of Veterinary Anaesthetists checklist. So that's just a useful resource. And then we get into the nitty-gritty. So with regards to the approach to anaesthesia, it is important to remember that anaesthesia is a controlled and reversible intoxication of the central nervous system, where the patient neither perceives nor recalls noxious stimuli. And it's that balance of being unconscious, being adequately analgesed, and having relaxed muscles to facilitate surgical access. And there's a whole pile of factors that contribute to your capacity to achieve anaesthesia in a controlled and reversible way, and to ensure that there's that balance of those three factors which create that triad of anaesthesia. There is no single drug that achieves perfect balanced anaesthesia on its own. A combination of drugs must always be used to achieve balanced anaesthesia, and that requires knowledge, skill, and understanding, particularly of pharmacokinetics and pharmacodynamics. So I'm sort of skipping through some of the not random, but not necessarily also the most interesting or most relevant, but some of the steps during the process of anaesthesia that are covered in the guidelines. And when it comes to pre-anaesthetic examination, with unsocialised cats, this may be impossible to do a clinical exam. So decisions around that animal's suitability for anaesthesia and the risk that it may present based upon its physical status have to be ascertained by looking at the animal from a distance, getting information from the carers, and observing their respiratory rate and effort, for example, their body condition, their coat quality, and understanding their demeanour and their temperament. Whereas with prepubertal cats, they're probably easier to perform a clinical exam on, but a subset of those prepubertal cats will be paediatric. So it's important to check that their size and their heart rate and their appetite and their stature actually fits with their age, to ensure that there's no suspicion of immature physiology in the context of how old they are. So one of the controversial parts of these guidelines was whether or not cat castrations, for example, should be intubated or not. So in experienced hands, this procedure is really short and pretty sweet, and intubation may take longer than the procedure in some instances, and intubation may introduce a whole new level of risk. And therefore, we've talked a little bit about the process of intubation, how to mitigate risk, and how to manage the whole process carefully to ensure that the benefits of it aren't outweighed by the harm. So if at all possible, the cats should be pre-oxygenated if they tolerate that. That therefore buys you a little bit of extra time if you're having trouble with the intubation. And intubating a cat is a little bit more of a skill maybe than in dogs. They're a little bit trickier to intubate, especially if they're small. So after a couple of minutes of pre-oxygenation, if they tolerate that without stress, with having an oxygen mask on their face, then anaesthesia can be induced, positioned in sternal recumbency, get a good view of the larynx, apply some topical local anaesthetic, give it time to work, insert the endotracheal tube, check it's in the right place, secure it, and inflate the cuff. Now, whether or not you use a plain uncuffed ET tube or one with a cuff, again, is up for debate, and again is a clinical decision that needs to be made. But if you do use a cuff, then you need to ensure that you inflate it only enough to create a seal, not to compress the little arterioles in the wall of the trachea. And there's a number of ways you can do that, and one of those little syringes like the one pictured there that give you an indication of the pressure within the cuff itself to ensure that it's safe. To confirm placement of the ET tube, a capnograph is by far and away the best tool to ensure that you're in the right place. Otherwise, there are a number of other little tricks and tests you can perform to check that you're in the right place. And it's vital that you're in the right place. Otherwise, it's very dangerous. There are a number of complications from intubation, which I'm sure many vets are aware of, and is one of the reasons they may justify the approach to not intubating a cat for a short procedure. But to mitigate those risks, there are a number of things you can do. And the big one is ensuring that they're adequately anaesthetized before they're intubated, that you use a local anesthetic and on the larynx, and that you make sure the ET tube's the right size and length. Okay, so skipping through to animal preparation, the latest American Animal Hospital Association guidelines say that for animals under 8 weeks of age or less than 2 kilos, fasting only needs to be for 1 to 2 hours, so long as the last meal was wet food. And for animals a little bit bigger than that, then fasting again only needs to be for 4 to 6 hours if the last meal was wet food. So that's a little bit of a shift, and particularly important for prepubertal cats. Moving on to pre-medication, this is a useful step in anaesthesia to ensure that animals can be restrained without undue stress for induction of anaesthesia, and to contribute to a balanced anaesthetic with multimodal preemptive analgesia. Pre-medication can be aimed at being light, moderate, or heavy, and depending on the temperament of the cat, and there's tables within the guidelines around the drug combinations that can be used to achieve one of those aims. It's important with little cats especially that the volume of drugs that's drawn up is accurate. It's very easy to inaccurately draw up very small volumes of drugs. So having a strategy to manage that is important, and whether or not that involves dilution of drugs or ensuring that you're using like little insulin syringes or syringes that inject some of the dead space as well. In this instance, if I was to use acepromazine and methadone for pre-medication of a cat, I would add the acepromazine to the methadone syringe. So the methadone in the dead space of that syringe contributes to the overall combination of drugs that's administered to the cat. So maybe I'm increasing the dose of methadone a tiny bit, but not the dose of acepromazine. Supportive care during anaesthesia is vital for success. That's covered in the guidelines, along with a lot of information about monitoring equipment, the limitations of it in cats, and to ensure that to be consistent with the latest and first, for that matter, position statement from the veterinary anaesthesia and analgesia chapter about the expectations of monitoring during anaesthesia, and having someone dedicated to the role of monitoring and recording those changes is important. And there's a lot of information in the guidelines on that, which enables you to manage and identify and manage the common complications that occur during anaesthesia, which are generally related to blood pressure, heart rate, and body temperature. So in the interest of time, I will just really quickly touch on multimodal analgesia, preemptive or preventive analgesia that's administered for a long enough duration. There's details within the guidelines about how to approach that. And then finally, it's important to have some sort of pain assessment regime up and going in your clinic. The Glasgow Feline Composite Measure Pain Scale is an option that's attached as an appendix to the guidelines. And there's also within that composite measure scale, the Grimace scale, which is now available as an app on your phone, which is really useful to assess pain, and scoring of the 5 action units can be performed to determine whether or not a cat needs extra analgesia. This is a brief summary of the key points within the guidelines, and we're going to have to finish off there. Thank you very much. I don't have any cats in my household because there's a few too many long-nosed dogs, but thank you for your time.